Hi, my name is Rebecca Q, and I'm from Roanoke, Virginia. My project looked at a drug called Peptide 18, which was modeled after an 18 amino acid specific motif found in a catalytic subunit of PI3K. This drug functions by binding to a regulatory unit and thus preventing the activation of the pathway. And while this is promising, the drug is limited by its relatively large size, which can give way to a higher potential for side effects. And so the goal of my project was to remove any redundancies that could be possible in the drug using computer modeling. So I began by creating models using a software called Peptide for all continual sequences of the drug between 6 and 18 amino acids. And the 5 most plausible or likely of which models were used to continue with docking simulation, which was done using a software called Autodoc Vina, a larger part of the Autodoc tool suite. This software gave back the 9 most plausible complexes and their binding affinities. In these complexes, their distances to the p85 alpha active sites were quantified using UCSF Chimeras distance function. In analyzing the data, several peptide fragments demonstrated comparable binding affinities as well as docking distances, but especially a 9 amino acid fragment stood out. And in running statistical analysis, it was determined that the binding affinity and docking distance demonstrated no statistical significance between the wild type. In running macromolecule simulations, the same thing was shown. And in conclusion, several truncated mutants were predicted to maintain the wild type's inhibitory potency while also yielding a drug that has improved cellular permeability and decreased side effects just due to the fact that they have comparable docking affinities as well as binding proximities when compared to the wild type drug.